Hello everyone, I am Dr. Madhu Shankar. I am a consultant nephrologist, renal transplant physician and specialist in clinical hypertension working at Sri Ramakrishna Hospital, Coimbatore. In this video, let us discuss about a few facts and myths associated with diabetes and kidney disease. We all know broadly that diabetes is of two types. Type 1 diabetes mellitus occurs in children requiring insulin, and type 2 diabetes mellitus occurs in adults. Diabetes mellitus of late has become more like a household disease. With onset occurring at much younger ages, we live with diabetes for a longer duration, and hence the complications that happens out of diabetes mellitus is also increasing at a rate which we have never seen before. For instance, diabetes can affect your eyes, heart, brain, nervous system and kidneys. Of all this, the most notorious, the one that is associated with the high rates of morbidity and mortality is renal complication of diabetes mellitus, also called as diabetic kidney disease or diabetic nephropathy. When the onset of the disease is at an younger age, when the sugar is not properly controlled, when there are other comorbid conditions like hypertension, obesity, the occurrence of kidney problem is more. So, roughly around 30 to 40% of those with diabetes mellitus can have some form of renal involvement. And with the increasing duration of diabetes, the chances of renal involvement is more than 50%. Worldwide, diabetes and hypertension are the leading causes of chronic kidney disease, leading on to end-stage renal disease requiring dialysis or transplantation. Roughly 1 in 3 requiring dialysis or transplantation is affected with diabetes mellitus, which means around 33% of those on dialysis or transplantation are diabetic, and diabetes is the leading cause for them going on to such a state. So then let us discuss about diabetes and chronic kidney disease. When does renal involvement actually start in those with diabetes mellitus? In those with type 1 diabetes, the renal involvement roughly starts 5 years after the diagnosis in majority of the cases, whereas in type 2 diabetes mellitus, the renal involvement can be seen at the time of diagnosis in roughly around 30 to 40% of the patients. What are the forms of renal involvement that can be seen in diabetes mellitus? It can be as simple as leaking protein in the urine, which when increases in magnitude causes troubles. And then as time goes by, there can be an increase in creatinine which will progress on to requiring dialysis or transplantation. So what are the signs and symptoms that can be seen when the kidneys are involved in those with diabetes? By and large, renal involvement is asymptomatic. It is usually found out incidentally when a blood or a urine investigation is done for some other reason. But as the proteinuria increases, one can start developing leg swelling, facial swelling, abdominal distension, breathlessness, etc. As the creatinine goes up to advanced stages, when the glomerular filtration drops down to 10 ml per minute or less, you develop signs of uremia like a reduction in appetite, nauseating sensation, vomiting, weight loss, etc. So then, what are the investigations that can be done to diagnose renal involvement in those with diabetes mellitus? It's quite simple. Urine examination to look for proteinuria, blood investigation to look for serum creatinine and other electrolytes, and ultrasound to look for kidney size and echoes. One organ is involved, it is likely that other organs can also be involved. So you must also look for coexisting hypertension, lipids, cardiac involvement, eye involvement with fundoscopy, echo and other investigations as appropriate. So then, when should we start these investigations and how frequently should these tests be done? As I said, in type 1 diabetes, the investigations for renal involvement should start 5 years after the diagnosis, and then it can be done annually. Whereas in type 2 diabetes, the investigation should be done at the time of diagnosis of diabetes, and then the frequency can vary once a year, once in 6 months, once in 3 months or every month depending upon your stage of kidney disease. Once diagnosed to have kidney disease, what is the next step? The first and foremost is do not panic. Do not press the panic button, do not raise the red flag, be calm. Just listen to what your doctor says with rapt attention. Because not every renal involvement is bad, not every renal involvement is going to take you to dialysis or transplantation. So listen to what your doctor says, get those investigations that are suggested by him, make sure your sugar is under control, you follow very healthy lifestyle in terms of diet, in terms of physical activity. One should take diet which is less in salt, and then physical activity for at least 30 minutes a day for 5 days in a week. These are minimum. A weight check and appropriate weight for the height and maintaining a body mass index is very essential. So once diagnosed to have renal involvement, please do not go in search for any alternate or unscientific forms of therapy. Stick on to your standard medications and make sure your sugar is under control. Your doctor will prescribe you medications to reduce the protein that is leaking in the urine, to reduce the swelling in the legs, and certain other medications that can slow down the progression of kidney disease, so that the time limit for you to reach an end stage either does not happen or it is postponed as much as possible. And then very important is avoid any unnecessary over-the-counter medications that can be potentially harmful to the kidney, like a painkiller or like an ulcer medication. Right. So let us look at some of the myths associated with diabetes and kidney disease. A general doubt that we have is, can insulin or any of the medicines that is used to control sugar cause renal failure? The answer is no. Insulin or any of the medicines prescribed by your doctor to control the sugar does not cause kidney failure, but the dose of those medications has to be altered, or certain medications has to be stopped based upon your creatinine and glomerular filtration. What is the role of diet in slowing the progression of kidney disease? The most important dietary modification that you have to carry out is reducing the salt. Your salt intake should not exceed 4 grams of sodium chloride in a day. The more the salt you take, the more your body volume, the pressure goes up, and then which will have a negative impact on other organ systems. Other than that, depending upon the proteinuria, the magnitude of protein that is leaking in the urine, you will have to alter your protein. Either very less protein or very high protein is not going to help you. The protein that you need could be 1 grams per kg per day, or 0.8 grams per kg per day, or even up to 1.2 grams per kg, depending upon the magnitude of protein that is leaking in the urine. Is there any form of therapy that can stop the progression or bring back your kidneys to normal? In a patient in whom the kidney failure is because of diabetes and which is chronic, which means which is for more than 3 to 6 months in duration, no medication can successfully reverse the creatinine to normal. But there are enough medications to slow down the progression so that your time limit to reach dialysis or transplantation is delayed as much as possible. So in short, there are 30 to 40% chances of developing kidney failure in those with diabetes mellitus. Most of the times it could be asymptomatic, found out incidentally, but then when there is increasing leg swelling, or when the urine is frothy, when there are other symptoms, then beware that a renal involvement could be going. Particularly when the sugar which was out of control suddenly becomes normal, so that your pills or insulin dose comes down, beware, renal involvement could be brewing and you need appropriate investigations to detect it. And once renal dysfunction is detected, do not panic, listen to your doctor's advice, do not waste your time and energy in search of something unscientific or something which is non-existent. Follow proper lifestyle modifications and physical activities and adequate tablets at appropriate doses, so that the progression from early stages to advanced stages of chronic kidney disease is slowed down and delayed as much as possible. When needed, dialysis is usually the final treatment, with transplantation being the best form of treatment for diabetes or any other forms of chronic kidney disease. Thank you.